Dr. David Schiller here, and today we're going to talk about why you still have thyroid symptoms. There's a number of reasons why, and the first one we want to get to is that you're not being evaluated appropriately. I want to ask you a question. How many markers do they look for when you go to the doctor? They take your blood, you get the report back, and basically whether you're seeing it or not, they're telling you everything is okay, but yet you still feel like you have symptoms and you're wondering why this is. Well, the thing is, they're not evaluating you completely. Typically, they're going to be looking for what is called TSH and maybe T4, and if they're really progressive, T3. The thing is, you got to understand there's way more markers than that. That's 3. There's actually 10. So this is total T4 and total T3. There's also free T4 and free T3. There's T3 uptake. There is reverse T3. There is TBG, thyroid binding globulin. There is TPO and thyroglobulin antibodies. And sometimes they may check for TSI antibodies if they're suspecting hyperthyroid or too high of a thyroid function. So each of these can be checked. This is what we check in our office, and the reason why we're checking these in our office is because they tell us a story. If all you're checking are a limited number of markers, you're going to have a limited picture of what's going on with that individual. The reason why they only check a couple of markers is because that is all they need to assess the dosage of your thyroid hormone. They'll use those to determine whether they're giving you too much or too little. But the problem is that the majority of thyroid or low thyroid patients, it's due to an autoimmune disease called Hashimoto's. And the idea is, if it is Hashimoto's, and there's a 90% chance that it is, monitoring your hormone levels through these markers is not addressing the autoimmune problem. Because if you do have an autoimmune disease, and again, 90% of you may, even if you went down to 70%, depending on which research you look at, 70 to 90% of the people that have low thyroid have that low thyroid due to an autoimmune disease called Hashimoto's. You are addressing the wrong thing. You're addressing a hormone problem when in fact it's your immune system that's the issue. So each of these thyroid markers tells a story, and in subsequent video editions we'll go over each one of these and discuss with you all the different patterns that are going on. So just to let you know, there's a bigger picture than you're being told. The problem is, if they're not looking at this, they're not getting the whole picture, and that's why you're still feeling the way you're feeling. Have a great day.